program or hot things that are coming up, our Wimberley's Roots cooking class over in Winder, which will be January the 30th, is full at the moment. That area holds 60 people, and so that, like as soon as we launched it, it went like hotcakes. So it's full. However, I do have a waiting list, and so we do plan to use our Facebook and post and just say, hey, if anybody's got, you know, a change in plans, change their mind, let us know so we can start freeing up some seats if anybody's interested. But that'll be over in Winder. And that's going to have Chef Juan. So for those of you who came in October or saw his video on YouTube, Chef Juan was one of our popular guest chefs, so that was really fun. The other big thing that we have is our patient celebration party. And so bring this in for those on YouTube. So this is our annual patient celebration. It will be down across the way, actually, at Lanier Tech. It's going to be on February the 22nd. All three of our surgeons will be there. The office staff will be there. We have a DJ. We have a dance floor. We have a menu that was created by all three of our dietitians, so it's bariatric friendly, tasty. We actually did taste testings, and we sent some dishes back, and we made some tweaks to others, so it tastes good. We have a professional photographer there with the red carpet. So what we have in here, it just says dress your best. So whether you're dressing for church or you're dressing in formal wear, it's all welcome. So you have your professional picture made with your support person, but we also have a fun photo booth on the inside where you can dress up with your friends, family, whatever big group of folks that you've met here, and you can print as many pictures out as you want for that. So lots of fun at the patient celebration. Believe it or not, this is almost booked as well. So we had some invitations that went out in the mail, and so we had some folks register that way on Friday. So I went ahead and launched it on our Facebook group on Friday, and we're getting close. So if you're interested in this, I would highly recommend that you grab one of these on your way out and go ahead and register. And if you're on YouTube, the link is nhs.com/celebration, because it's all about celebrating you, your progress, the long journey that you've been on. And so excited to see people there. If you have not been in a while or you're new to our program, we do yoga in this room on the third Monday of every month before support group. On the second Friday of every month, we also have bariatric weightlifting in this room around the support group there. And then we also offer monthly cooking classes, which is located at the Gainesville campus in the South Patient Tower. That's the first Wednesday of every month. And so lots of ways to get engaged. We also have the Berry Boutique upstairs, which is a beautiful space. It's in Suite 260 where our dietitian is, and the Berry Boutique is a place where you can go shop for free at a gently used clothes. Actually has some really nice fancy clothes, suits, ties, things like that. So if anybody's looking for something to wear to the patient celebration, that's a good place to get that as well. I think the other two things to know is if you're not with us on Facebook, we have a closed Facebook group for our patients. You can search us by NGMC, so Northeast Georgia Medical Center Bariatrics, to join. And then we always live stream on YouTube, and so you can check us out. That's a public channel, so anybody can watch that. So tonight we're talking about how to stay healthy after having weight loss surgery. So I put a few things in here. There's a lot of things that you could talk about, but one of the things that I put up here was about things to avoid. And so on our Facebook group lately, I've heard questions like, you know, when is it safe for me to take Advil again or this again? And so just remember that just say no to these kind of things. So any NSAIDs we really want to stay away from, and that's a forever thing. So Advil, Motrin, Mobic is a commonly used medication for arthritis and things. The reason that we avoid them is because it really sets our patients up for gastric ulcers after surgery. And so we try to find other medications that we can use instead. And so if you're somebody who has joint pain, there are medications that are in gel form that doesn't go through the stomach or the GI system that you can rub on your joints. It's pretty effective, but we can look at other alternatives. Some medications are absorbed through the skin, things like that. Steroids is a big no-no as well. So steroids make your tissue very thin on the outside, but your organ tissue as well. And so again, it can increase the risk of developing gastric ulcers. So what I always recommend is if you get in a sticky situation, when you go to your primary care, urgent care, whatever, they try to prescribe some of these things to you. You need to make sure that they know that you have had weight loss surgery, so that they know your surgical history. But then again, some providers still are not up to speed with our specialty and how to take care of patients afterwards. So you may have to say, I can't have that, what else can I have? But when all else fails, give your bariatric surgeon's office a call, talk with their nurse, because there are some situations to where patients do have to go on steroids, even though it's contraindicated. And if that is a situation for you, they may want to put you on a medication to protect your stomach during that limited time. So definitely keep them in the loop. Smoking, caffeine, alcohol, all three of those things can increase the risk of gastric ulcers. And so just a refresher on how to keep yourself safe and healthy after surgery. Another thing that's really common, believe it or not, before and after, is orthopedic surgeons now, it's pretty much standard of care that if you have somebody that needs to have a total joint replacement, that we want to get their weight to a healthy level. And so some surgeons are now, if somebody has a BMI of 50 or higher, are now referring over to get the patient's weight under control for a few reasons. If somebody goes into surgery at a healthier weight with their other health conditions under better control, it reduces the complication risk, it reduces how long they have to stay in the hospital, it increases how quickly they can recover, but it also makes that total joint that gets put in last a lot longer. And so one of the fun facts is for every pound that you have either you're going to lose or you have already lost, you reduce the pounds of pressure to your joint by 3 pounds. So it's 3 times the pressure on your joints. And so just a fun fact, but thought we'd talk a little bit about that because back and joint pain is very common with our patients. The other thing that I thought we'd talk about tonight is vitamins. We talk a lot about vitamins because vitamin deficiencies can be bad, and we know it's not a matter of but rather a matter of when vitamin deficiencies can develop after surgery. So some of our patients, believe it or not, come into us with existing issues, already having iron deficiency, already having vitamin D deficiency. A great number of our patients, and I think we were somewhere around 75% of our patients, already had vitamin D deficiency before they even had surgery. The reason behind that is vitamin D is a fat-soluble vitamin, and so it's caught up in those cells. And so some things that we, kind of nice to know what it's used for. So vitamin D is important so that your body can actually absorb calcium. If you have low vitamin D, your body's not going to be able to absorb calcium correctly. And if your calcium level drops, your body is smart. It knows that your body already has a store of calcium in your bones, so it begins to actually pull calcium out of your bones, which creates weak, brittle bones. So that's why it's important. And you would know sometimes by your symptoms that you potentially could have vitamin D deficiency because you may suffer from fatigue, bone pain, muscle weakness, and believe it or not, it can be associated with depression. And so if you're having any of these symptoms and you have not had your vitamin levels checked, I would highly encourage you. One thing that we know is if somebody, even if you don't have pre-existing deficiencies, it can take anywhere from 2 to 5 years for some of these deficiencies to actually show up in your blood work. And so what I find in my experience is patients are very good at going back to their bariatric surgeon's office immediately after, even maybe a year after. But when patients hit about a year, 18 months out, then they tend to not follow up as much, right? Well, the idea with bariatrics is this is a lifelong chronic condition, and it's complex. And so it kind of implies lifelong treatment. And so even if you're doing well, the surgeons want to see you at least once a year, so it's kind of like your bariatric physical. Now, what we don't care about is we don't care where you get your labs drawn, okay? You could get them drawn at the office or you can get them drawn at your primary care's office, but what you need to know, I'm a firm believer in if you're going to get stuck, only do it one time because it hurts. So make sure that you're getting the correct labs drawn. When you go for a physical at your primary care doctor's office, they're not going to necessarily be drawing the specific vitamins that we're worried about. Now, there's a lot of vitamin deficiencies that can be related to bariatric surgery, but tonight I'm only focusing on the top 3 because they're the most commonly seen. So vitamin D, B12, and iron or ferritin is the lab that we draw for that. But there's also zinc, copper, there's a lot of other vitamins, but be sure to talk to your surgeon if you're feeling any of these things. Thiamine is another one that we don't necessarily draw commonly, but depending on how you're feeling, what your symptoms are, it may be necessary. So if you were to be experiencing any of these things, you would want to have your blood work done. Some sources of vitamin D, you can get it from fortified milk, you can get it from cheese, you can get it from the fish like salmon, tuna. I don't know how you feel about sardines, it kind of has a bad rep, but it's high in vitamin D. The cool thing is that if you, not this weather, okay, because it's cold, just saying, but, and that's why some of us have vitamin D deficiency, because we stay inside a lot, it's cold, we don't get outside as much. But the recommended exposure to sun is 15 to 20 minutes 3 days a week, because you can actually absorb it through your skin for vitamin D. So that's a couple things. Now, you can take vitamin D over the counter or in your bariatric vitamins, but if you're deficient, your surgeon's likely going to need to give you a prescription strength vitamin D for you to get enough for your body to absorb to build it back up. So B12, so some things to know about B12. It helps in the formation of your red blood cells. It aids in metabolism. It helps to prevent anemia or iron deficiency. And it helps to maintain your nervous system. Also helps to make DNA, which is the building blocks of our body. So the symptoms of B12 deficiency are things like fatigue. Do you notice that there's that theme of being tired and fatigue? Okay. Shortness of breath, dizziness, pale or yellowish skin, irregular heart rate or beat, weight loss, numbness or tingling in your hands or feet. So now we're talking like kind of nerve damage and things like that, and muscle weakness. So some things to think about. Sources through your diet would be fish, chicken, eggs, milk, fortified cereals. So a lot of these things you can focus on through your diet, but after having this type of surgery, your body, especially if you have the gastric bypass, is simply not going to absorb everything that you eat or drink, which is also true for the DS or duodenal switch. So some things to think about with B12 is that you can get B12 in many different forms. Okay, and the good thing about B12 is it's water soluble. So if you take too much B12, it's not something really that you have to worry about, because if you get too much B12 built up, you go to the restroom, it comes out in your urine, your body takes care of it because it's water soluble. So it's just going to rinse out of your body any of the excess that you have. So there's many different ways that you can take B12. One form is through under the tongue, so sublingual, where you can put it underneath there. They do have some that are chewable, but underneath your tongue is a good way. Some people get monthly shots, so people who already had pre-existing B12 deficiency may still continue to get shots after surgery. But there's actually a way that you can take it nasally, and it's only once a week. And so I don't know if any of you guys have heard about that, but the company is called Nascobal, and that's a company that is recommended by ASMBS, which is our national organization. So when they talk about what their guidelines or recommendations are for vitamins, this is one that they support because it gives your body everything you need just once a week. You want to come up this way?
Sure.
So this is Gio, and he's here just to talk to you about his product if anybody's interested. We're not selling anything, but he's going to give you the spiel on, if you're interested, Nascobal through the nose. Because when I heard about it like 10 years ago, I'm like, through your nose? What?
Yeah, cool.
Okay.
Thanks for having me, Amy.
Sure.
And obviously y'all as well. Thanks for bringing me in. Really easy. Amy kind of hit the nail on the head. So Nascobal's once a week dosing. Obviously going through pre or post-op surgery. When you spray, you're bypassing the GI tract. So Nascobal goes straight into your nasal mucosa. So obviously levels shoot straight up versus, we talked about injections. There's a peak and trough with that. You got it down on the week 2, 3, 4 versus when you spray Nascobal. In an hour and a half, your levels are up and sustained 46% above baseline in 72 hours from the time you spray. So it's one spray, one nostril, once a week. There's a form back there on the table, real easy. Probably take 2 minutes to fill out. Amy will fax in to ProCare. They'll call you at the end of the day, potentially $0 delivered to your house every 30 days. So once again, you get 4 of these. Really easy, 500 micrograms in there, spray once a week, sustain levels. That easy.
So when you said potentially, what does that mean?
So commercially insured, 85%, roughly 8 out of 10 people, you'll get that for $0. But you won't know until that form's filled out.
Okay.
Yeah.
And then they contact the patient, or
ProCare will contact you guys, you get a text and or phone call, and they'll keep hunting you down if they don't get you. But they'll let you know, hey, Miss Andrews, you verified for $0. Would you like it? 3 to 5 business days from there, it's on your front door. $0.
Mm-hmm. Any questions?
Yeah.
And that's just B12?
This is B12, yes ma'am. Basketball.
Mm-hmm.
Yeah.
All right. You got some handouts in the back, right?
Yeah, I've got some stuff back there.
Awesome. Thank you. Appreciate it.
Yes ma'am.
Okay. Importance of iron. So this is a big one. And kind of in my experience, what I've seen, some people come to us before surgery with iron deficiency, but really what I've seen is after surgery, especially females that are still in the years of where they're menstruating every month, if they've got really heavy periods, those are really the females that I'm finding that struggle. And it's not really just the gastric bypass. I've seen it a lot in sleeves as well. And so a lot of times I'll have conversations with them, and there's different procedures that GYNs can do these days to try to get the flow under control, but really, yes, we can throw vitamins at it to try to get the iron level up, but if it's a bleeding issue, we really need to get to the source of what the bleeding is while we're supplementing it so that we can keep the iron level up. Now, the big thing about iron is it takes a red blood cell and an iron cell to be able to carry this oxygen around the body. And so if you're lacking one or the other, you're not getting it circulated really well. So you can be on 100% oxygen, but if you don't have enough red blood cells in your body, like somebody who's had massive bleeding or something like that, you're not going to have oxygen circulating. Well, if you have enough red blood cells, you're good to go on that, but you don't have enough iron molecules attached to it because you've got anemia, you've got low levels, then again, it's not going to be able to carry the ball of the oxygen around the body. And so that's why iron is so important. So it plays a role in producing energy. If you're not circulating enough oxygen around your body, you're going to be tired all the time. So here's a long list of symptoms here when we talk about iron deficiency. So again, there's that word, you're tired, right? Paleness, shortness of breath, and that's again because you're not able to circulate that oxygen around as much. Headache, dizziness, heart palpitations, dry and damaged hair follicles and nails, swelling or soreness of the tongue and mouth, restless legs, cold hands and feet, frequent infections, anxiety. And here's the one I always suspect when I'm sitting around support group and somebody's over there chomping on ice. I'm like, have you had your iron level checked recently? Now they talk about dirt, clay, chalk. It's a condition called pica. Some women get it when they're pregnant, but really the biggest one I have seen is people are sitting around chomping on ice, and it's like, okay, you might need your level checked. Some things to think about when it comes to iron supplementation. If you're taking an iron supplement, you do need to be aware of when you're taking other things. So food can decrease the absorption of iron, so the recommendation is that you take it 2 hours after eating the last meal of the day. However, for some people it causes nausea, so you got to kind of balance that out. Vitamin C actually does increase the absorption of iron, so you'll see some supplements have iron, but they'll have vitamin C in there as well. And so it talks about supplements can cause GI side effects. So it can cause constipation if you're taking a high enough dose, or it can cause nausea. It can be hard on the stomach sometimes. So one of the recommendations that they have is if it's difficult to tolerate, break it up into 2 doses so that you're taking a smaller dose at a time. So take 1 in the morning, 1 at night. So some ways that you can get iron in your diet: shellfish, spinach, red meat, beans. You'll see in a lot of times our cooking classes will use beans. So beans, lentils, chickpeas, and soybeans is a good way that you can get that out of your diet. So, and I think this is the last slide that we'll open up to support group, but vitamin deficiencies, we can definitely see a lot of those after weight loss surgery. The key to prevention is taking those vitamins and taking them consistently. Like I said, a lot of times it doesn't show up until 2 to 5 years out, and if you're just hit or miss not taking it consistently, then that's really when it can come on. And so you definitely want to make sure that you're getting the correct labs done and that you do it at a minimum once a year. And if you develop a vitamin deficiency and they've told you to increase your B12 dose or increase your iron dose or vitamin D, you want to go back to have that level rechecked to make sure it's come up so that you can keep it consistent at whatever dose it took to get it that way. And so just remember, after bariatric surgery, the key is that when you're taking vitamins, we have to kind of throw more at your body than what you would somebody who doesn't have an altered GI system, because it has to take more in to have the opportunity to absorb it. So at the end here, I just said, vitamin deficiencies can cause some irreversible effects depending on that vitamin and the deficiency level. So really, you just need to stay engaged with your doctor's office. And again, the nurses don't mind it. Even if you just call them and say, hey, I'm going for blood work tomorrow, what do you think I need to have drawn? Then you can make sure that you're getting the correct things. And if you're having any weird symptoms, run it by them, because you may have a micro deficiency of something going on, and they may recommend that you have different vitamin levels drawn. So I think that's all of that I had, but we'll just open it up to support group. What's going on with you guys?
I have a question about calcium.
Okay.
Because I constantly forgetting to take it.
Yeah.
Because I, take it 2 hours after everything else. And I try to keep, the little chewable stuff even on my coffee table. So maybe at night I'm like, oh, I have a piece of candy. But I still forget to do it.
Yeah.
Is there a different form of calcium that you can just take with everything so you can do it all at once?
It would be nice. The thing about calcium is that physically your body cannot absorb more than 500 milligrams at a time. And so that's why a lot of times you'll hear them say, take it 3 times a day or 4 times a day, because if you pop 1,500 milligrams right now, your body's going to absorb 500, and then that's it. The rest is kind of a waste. So that's why it's just an absorption thing. It can only take so much at a time. I know. It sounds like you've got a good plan, kind of leaving a trail around for yourself.
Just do it.
Yeah.
There's no phone time.
Yeah, that's a good one.
That alarm.
That's good.
You don't always have low B12 though. I'm at the higher side where they've almost taken me off.
Yeah.
I'm
One thing I've noticed is it depends on when they took B12 last, because I've had patients that took it and then they went to have their blood work done, and it's like, woo, they're high.
Yeah.
So sometimes I wonder about the
I've been off
timing
it.
when it's really high like that. But again, the good thing is your body's excreting it, you're getting rid of it, it's not a big deal. But that's good that yours is high, right?
Mine is extremely high.
Yeah.
But yeah, I'd already been off it a full year, and it was still
And it's still high. Wow.
But the iron is too low. That hit me around, it was probably after a year post-op. I started bruising, and then I started eating ice. And my coworker, who's anemic, said, "Maybe go get your blood done."
It's common.
She
Yep.
picked up on the ice chewing when I did.
Yeah, that's kind of funny. It's one of those weird symptoms, but yeah. What else?
I'm personally having a hard time because I have ulcerative colitis too.
Yeah.
So,
Hard time with the diet or vitamins or.
with the diet, and I mean, basically there was a period where all I could eat was just maybe some yogurt and a piece of toast. So I lost a lot of weight then, and now I'm really a lot better, and I've gained some weight. So just trying to.
Are you able to eat solid foods now?
Yeah.
Okay. Sometimes, and of course your situation is unique, right? But sometimes what I find is if patients have things that come up and it forces them to not be able to eat solid foods, and they're eating like the full liquid kind of consistency of foods, that's when we see the weight go up, because they are eating soft foods that sometimes have more calories in them and things like that. And so, it's trying to get back to the solid protein and things like that, which is what's going to make you feel fuller faster and for longer. So protein's key, but I'm glad you're feeling a lot better, but that is common when people
It's been a
start
5-year
to.
battle, so
Oh,
I'm,
yeah.
you know,
Yep.
You're how many years post-op now?
I had it in 2011.
Yeah.
So as you said, I'm fighting the reason I come back is to help reset.
Yeah.
Because I'm 3 years post-op now, and
Sometimes it takes that. Just reset it, right? And some of it is the mental piece of getting back in the game, right? But physically, physically that tool is still there.
Yeah.
You know, and I've had patients over the years that I've done this that would call and say, I think there's something wrong with my pouch, right? And I have literally had the doctor do another upper GI and compare it to the surgery day to then, and it be almost exact. Not saying that we can't have, you know, issues with, especially in the gastric bypass with outlet, you know, dilatation and things like that. But 9 times out of 10, that physical tool is still there. You just mentally have to reset and get back in the mindset. So I've had people that would go back on the meal replacements for a week, sometimes 2, just to kind of, you know, get back in the habit, because you know how to do it. It's just remembering how to use that physical tool. And, you know, one of the biggest keys is just remembering to eat at mealtime and then drink that water in between without snacking in between, because that's the #1 thing that leads to weight gain. Yep. But it becomes habit, right?
And you know what you're doing.
Yeah.
When you do it.
Yeah. And sometimes it becomes
You tell
mindless
yourself,
too.
I shouldn't do this.
As you're doing it.
And sometimes it becomes mindless because you start, you know, especially if you're doing it in front of the TV or driving or, you know, in those quick moments, and then you look down, you're like, oh my gosh, what did I just do, right? So getting back into that mindful eating piece.
I'm surprised that, like, when I do go back to meal replacement and drinking protein shake or protein bar, how quickly I reset, because I seem to get very full very fast.
Yep.
You know, and it's like, well, maybe it wasn't as bad as I thought it was. You know, I was just grazing more, and because I have a tendency to do that a little bit more, especially if I don't feel like I'm eating as much as I should.
Right.
And have a meal, and I'll wait, and half an hour later eat a little something else or finish what I had or whatever. But when I do that, like, you know, I go to exercise, you know, 10 o'clock in the morning, and if I eat real food, I don't do well. So usually I've been drinking protein shakes and clear protein in between some classes. And then when I eat, I'm like, I'm really full. I'm surprised at how quickly, and I'm like, I'm eating enough, you know?
Right. And remember, when you go, like, if you were to go back on the shakes for just even like 2 or 3 days, that gets you through that kind of withdrawal period and kind of helps to reset as well. So, yep. What else you guys thinking about tonight?
I'm just grateful that Tylenol isn't on that list. I live on it.
Yeah.
So, I have fibromyalgia, and I cannot imagine life without Tylenol 650. So, I was worried about that when I saw it on Facebook. I'm like, oh no, this can't happen.
Yeah. We actually use the IV form of Tylenol around our surgeries because it crosses the blood-brain barrier, whereas the oral kind that you take doesn't, so it helps to decrease how much pain our patients sense that they're having. Yeah.
I'm pre-op. Sorry, I'm in a post-op class, but
That's okay.
I'm pre-op,
Learn from
and
each other.
my biggest problem is it's too much for me. So I'm constantly eating, and it is driving me insane. It's literally, I mean, well, she's on it too. We're both of us going crazy because it's constantly we're in the kitchen or we're eating, and it's just by the time 5 o'clock in the afternoon comes around, I'm like, okay, I'm done. I don't want to eat anymore. You know, it's. Which is good, I guess, but at the same time, I'm not getting enough. I don't know.
What are you having to eat? How many calories does it have?
she's
Like,
got
I don't know where
she's
you're
got
at.
under 1,200 calories, but I'm averaging from 500 to 700 calories a day on my food journal.
So I didn't have that problem for you.
And you're on full
I had
liquids?
it after.
No, this is until, I'm full liquids this week because of the gallbladder surgery.
Right.
Before that was, stage 4, and my food journal's pretty much 500 to 700 calories. And,
Are you on the supervised diet period? Is that what you're on?
yeah.
Okay.
So, I mean, it's just a lot. It's a lot to eat. And then this last month, I didn't gain weight, but I only lost 2 pounds because I was drinking protein shakes and I wasn't supposed to. Didn't know that. And so they actually made me not lose as much. I was staying right around, lose a pound, gain a pound, lose a pound, gain a pound. It's just way too much information constantly. And way too much food. And I'm doing it, but I'm forcing myself to eat, and like this full liquids for a week is fine, and I'm so grateful for you because I was telling her I'm so sick of sweet stuff. It's just great.
You start craving the salt, right?
I just want salt. I just want salt, and there's not a whole lot of liquid option besides broth for salt.
You'll have to let me know how the chili flavored is.
I'm having something nice.
Yeah, I tasted it at conference. I'm like, I'm gonna need a box of that, okay?
Yeah.
just for some other alternative,
Yeah, you can have, she's got me on this exact, this is what we have for breakfast, exact meals, and everything is sweet, everything except for a cup of broth and one little half cup of cottage cheese, and everything else is sweet, and I'm like, I just can't do that,
Do you like cottage cheese though? I couldn't stomach cottage cheese, but it's loaded with protein.
I like 2% cottage cheese, and she's got me on 1%, and that is just nasty.
It's excellent.
Oh, nasty. I'm very picky. I'm picky. I can't help it.
With cottage cheese, I don't like cottage cheese, so I'm just throwing this out there. I mean, can you put like seasonings in it that might?
Well, I was thinking pepper.
Pepper.
I put salt and pepper in mine.
Yeah. She loads hers with
I
pepper.
was thinking maybe some chicken bouillon or something. Because they're for extra protein and salt, and that might be good. But anything to get something besides chocolate and caramel. But that's my biggest struggle.
After my surgery, I thought if I drink one more shake, I'm gonna just throw up. I'm like, I am done with these shakes, but after being, off of them for a while, every once in a while, they taste pretty good now, but they're even messing with the whole diet. It's like, I have a question, because I'm kind of curious, because you sound like a friend of mine, and she needs to have a hip replacement, and the doctor doesn't want to do it until she loses weight. She's for a year been trying to get like 25, 30 pounds off, and she just can't seem to do it. And of course she has problems. She's like, I'm not hungry, I forget to eat. And I'm like, you're gonna have to, force yourself to eat 3 meals a day. Don't wait until 2 in the afternoon and realize I haven't eaten, I'm hungry. But she's like, she said, I gained 11 pounds over Christmas, and I didn't really do that. I don't drink, I had some wine, and she hardly eats. And she's like, for me, all I have to do, she's literally one of these people that looks at food and gains weight. When we go out to eat, she's very, grilled chicken and salad and all of that kind of stuff. And I, I feel for her. And, I try to give her the best advice I can based on what I've been through. But, like I said, you feel like you're eating next to nothing, but you're only losing a pound or 2. And
Working with a dietitian, at least to have something like the plan that you're talking about, so you know exactly what, you've got the to-do list of things to do, can be very helpful for a lot of people.
Mom and I both maintained a certain weight for years and wouldn't lose pounds, and we wouldn't eat till maybe a meal at 5 o'clock, and that was it. Literally 1 meal a day. And
starvation.
as soon as they put us on, like 5 meals a day, 5 meals a day, but 5 little meals a day, snacks too, I started dropping weight. She's not even going to bariatric surgery, but she's
That's where the
She's not
dietitian
local.
can be key.
Yeah, I did.
So if she's local, just let her know about Giselle. And you guys know that after surgery, you guys can see Giselle for free as often as you need to, right? One thing I forgot to mention, and some of you may have heard this at one of the other support groups, but the other exciting thing that's about to happen in our program is we got approved for a full-time therapist specific to bariatrics. And so we're in the process of interviewing right now, but this person would help to facilitate and coordinate some of the support groups, bring what I feel like will be more engaging topics for you guys, because they're going to come at it from the mental health kind of perspective, and then we'll still have the nurse and the dietitian. That's really the standard nationwide. So I'm excited to have that added in. But this person will also be able to do individualized counseling, and will be located upstairs in Suite 260 in a private, office. And so not everybody needs counseling, but many people do. And so I think it'll be just a nice addition to our program. So more to come on that, but
I'd love to see some of the support groups.
yeah, absolutely.
Give us some ideas to think about.
That's
also
right.
some reading materials. And
Yeah.
things that might help get us over the hump.
Yeah, exactly. So I'm excited. Like I've seen a lot of in my past support groups that have been taught by therapists, and it's just the topics they're able to bring. I mean, I'm a nurse. I can talk to you all day long about vitamin deficiency and physical things, but they get into the feelings part, and how to navigate different things. So excited to have them come once we get them here.
Now, where's the Giselle?
So Giselle is located. She is in Brazelton 2 days a week, near the imaging center next to Brazelton Hospital, and then she's here Monday, Wednesday, Friday upstairs in Suite 260 where the Berry Boutique is.
I love her support groups too. I mean,
Hers is the most popular support group.
Mondays you
Fabulous
hear her
dancer
share.
too.
Well, I was telling her, like I said, I posted on Facebook about the patient celebration party, and then I came in this morning. I said, guys, you're not going to believe it. Like, we're almost booked. And I looked over at her, and she got a smile on her face. I said, you'll have a lot of people to dance with, because she's a dancer. I'm like, oh my
She got out
gosh.
there and pulled it up.
Yeah.
Last party we had.
Uh-huh. It'll be fun. Yeah.
We had to make people get out there though,
Yeah.
at first.
Well, the DJ, his name is Josh. He's going to be there at our event, but I've worked with him before at previous bariatric type celebrations. And what I love about him is he's very interactive, and he wears like a headset, and he'll put something on. He'll go, "Do you know this one?" And he'll be like, "Do you know this dance? Have you ever done it before?" And he'll like call people out on the dance floor, and he'll teach you how to do it in the moment. And so he's awesome. He'll get it exciting. Yeah. So, anything that you guys are proud about, like you're happy, like, hey, I'm able to do this that I wasn't able to do before, or anything that, if you're pre-op, anything that you're looking forward to being able to do. Yeah.
It's very painful right now.
Right. Yeah.
Well, one of the things that I've been proud of, because I see a lot of gastric people who fall right back into it, is not drinking the carbonated drinks.
Mm-hmm.
And I was addicted,
Sure.
and I lied. I just tell you, I lied. I told them I quit, but my last one was the night before my surgery.
Oh.
I did everything but that.
Yeah.
I did everything because Dr. Wynn would kill me if he knew.
Yes, you
But
have.
yes, he would have. I know him.
And he can't see you, so what happens in group stays in group.
And but I was really addicted, and I mean, I drank at least probably 3 cases a week. And so for me to have stopped that completely, I'm proud of myself for that.
Good.
And
That
I've
is
not been
hard.
tempted to go back to it.
That's hard.
So
Now, did you substitute something else so that you didn't feel like you were depriving yourself, or what worked for you?
I did not at first. I mainly stuck just to the water.
Mm-hmm.
And I drank it for a long, long time, and then I felt deprived, so I drank unsweet tea with some kind of sweetener.
Mm-hmm.
But then as I developed the ulcerative colitis and I began to Google what I'm putting in my body, Splenda kills 50% of your good gut bacteria and can cause diarrhea. And if you have UC, you don't need that.
Yeah.
And so now I do one little pack of stevia with unsweet tea. So,
Good.
and that makes me feel like I'm not deprived in the morning. But you can have your coffee. I hate coffee.
Yeah.
But
You're not a coffee drinker.
oh no, I hate coffee. I hate the smell of it.
Yeah.
But that helps me a lot, you know, just to be able to have them say I'm not deprived. I've got something too,
That's right.
you know. So that's a big thing.
And that's why I ask, because a lot of patients, that's what I have seen, is that people tend to be a lot more successful if they find something else that they like and they substitute it so that they don't feel like they're being deprived. And that, and just to, for a long-term change, you know. Yeah.
I like flavored waters. I just don't like plain water.
I drink more if I have not like my Crystal Light stuff in it.
Have you guys used the fruit
Plain, I don't-
infusers before?
Yeah, but I'm not a.
Yeah. I found if you take frozen fruit and put it in there, then it just kind of, you know, it keeps the water cold, but it infuses it with some flavor.
Every once in a while, I'll crave a Diet Coke or Coke Zero or something. I'll maybe have, you know, like a little bit and drink it very, very slowly. Then I leave the rest of it on the counter and let it go flat. And everybody's like, that's flat. I'm like, it's the flavor. I don't care if it's carbonated or not. It just, every once in a while I want that taste, you know.
Well, years ago, I was the Tab addict.
Oh my.
And-
remember my
and
mother
it
drinking
took me
Tab
3
back in the
times
Atkins
quit.
diet when it
Yeah.
first-
It took me 3 times giving that up to get off of it. And then I jumped right into Diet Coke and then to caffeine-free Diet Coke.
Makes you wonder what's in it that makes people addicted, right?
Yes,
Mm-hmm.
very much so.
Yeah. Mm-hmm.
But you were talking about things you enjoy doing or whatever, tub baths. I love the tub baths now. Before, it was never an option because there was no way I could get down or up.
Mm-hmm.
And now I love it.
How much did you lose?
220 pounds.
Wow, that's amazing.
Tub baths can be therapeutic. Not only is it relaxing, but I did work with a therapist that would talk about literally running yourself a bath, getting in, and just closing your eyes and feeling the water touch the edges of your body so that you could reconnect your mind with the new size. So you guys have probably heard me talk a lot about that, you know, whether it's trying on clothes or looking at comparison pictures or taking your measurements and knowing how many inches you lost versus how many pounds you lost and things like that. That's one of the reasons we have the Berry Boutique up there, so that people can go try on clothes, because as you're losing down, you don't know what size you are, you know, but those to me are the most exciting pictures, is when somebody posts something on our Facebook group and they go, you won't believe what I made it into today. Because it's not about the number on the scale, it's about how you feel, it's about those kind of changes, what you're able to do now, you know, that you weren't before.
Well, I can walk and get around now when I couldn't before. And I had atrial fib, and before they wouldn't have touched me to do anything, and then I ended up having a heart ablation in 2014. So that made a big difference in my health too.
Good. Yeah.
Just have more energy, you know. I enjoy being active, you know. You always say, you know, don't exercise, get addicted, but I can't say I'm addicted, but I enjoy it more,
Yeah.
you know. There's some days, I mean, I have to make myself do it, but when I'm done, I'm like, God, I feel so much better.
What else do you do besides yoga?
I do a walking class. Our subdivision has a walking class at our clubhouse, and it's the Leslie Sansone Walking Off the Pounds. And there's probably at least 50 people in this class, but I mean, she does like kicks and side steps and grapevines and walking and walk out, walk back, walk sideways, do some punches and arms. So you're not
More
just
than just
standing.
walking. Okay,
Yeah,
yeah.
it's more than just walking. And it's you know, good music that has a really good beat,
Yeah.
which, you know, that picks up the pace too and all. So I you know, hesitated to go because I'm thinking, how boring standing in a room just walking in place. But once I went, I'm like, this is fun. You know,
Uh-huh.
and there are a lot of people that go. And
Yeah.
so what I've started doing since the first of the year, I discovered that Francis Meadows Silver Sneakers is free. So I go to my walking class on Monday, Wednesday, and Friday, and then I leave there and drive to Gentle Yoga over at the community center. And then on Tuesdays, there's a more strenuous yoga, and then right after that, there's the strength and balance class, which is more just standing and, trying to balance and move your arm. And she's like, this is the strength part,
Uh-huh.
gotta keep you from falling.
And did you ever think you'd do all that before?
No.
And I go to Francis Meadows, but I go to the water, to the gentle movement.
Yeah.
And I thought,
Jan still do those
Yes.
classes?
yes. And I thought, oh man, I do not want to go out there, but they look as bad as I do, so I don't worry about it anymore. So, I mean, you
Jan
know.
said you're not worried about it.
Yes.
Every once in a while, we I'll go to Zumba. I like Zumba, but I like it somebody that does a more gentle Zumba.
You know, when we put on Facebook to vote, before we added the weightlifting, we put a poll on there, and I knew that Zumba was what was going to be chosen, but they chose the weightlifting. I was like, okay, that's something different.
And to be honest, when I came to the first weight class, it was a lot more strenuous than I thought it would be.
Yep.
And as many people haven't been coming, so I wonder if that's why.
I don't know. I do know that we're probably going to be changing it to after her support group because it's really early and she's now got a time conflict. So I'm wondering if more people might stay if it's not so early in the morning. So I'll be interested to see what happens this next month. We need to get that information out there soon. But I know, right? Yeah.
I'm here. Where is everything?
Exactly. Have any of you guys been to the cooking classes yet?
Oh, you should go. You should go.
It's fun.
Oh, yeah.
You get a free meal out of it, but you also get an apron, one of our aprons that's nice, and then you leave with the recipe cards. We've got all those recipe cards that we've collected over this past year on the recipe wall upstairs. So you guys are welcome after we get done down here to go shop in the Berry Boutique. You can go look at recipe cards. If anybody needs vitamin or protein samples, I've got those as well. You guys are welcome to come up and look around.
Speaking of vitamins, I went to order my multivitamin last night. Is bariatric pantry not in business anymore? Have you heard anything?
I don't know. I haven't heard anything about it.
Somebody at one of the other support groups said they closed.
I wondered because the app
but
didn't work, and then when I searched, I didn't find it. Now, the last time I had tried to order from her, she was out of stock of the Bariatric Advantage brand. And so I had ordered through Amazon, but last night I was like, well, I'm gonna give it a try, see if she's got it, and then I was like, couldn't find it, you know. I was like, the app doesn't exist anymore. I was like,
Oh, boy.
She must not be in business anymore.
I have samples of Bariatric Advantage upstairs.
I have plenty. I was just proactively ordering. So.
And then Bariatric Pal, we're on their free program, so I have free vitamins from them too.
One of my neighbors used to work in bariatrics before she moved down here, and she said her doctor recommended Women's Alive Ultra Potency 1-a-day vitamins. And I've been taking those the vitamin shop, and they are so much less expensive than the others. And when I get an empty bottle, I ought to bring it to you to look at. But
Yeah, let's compare.
When I first bought them, I was standing in the GNC or wherever comparing bariatric vitamins, and some of the Women's Ultra Potency had higher levels of ingredients than some of the bariatrics and all. And,
We did a comparison over this last year. I shared the data with the surgeons back in December, but we looked at all of the different bariatric vitamins. We compared to Flintstones, but looking all the way across Bariatric Pal, not only did they send me vitamins free, so if anybody needs vitamins, they can't afford vitamins, then we have them. But the bariatric PAL vitamins, if you were to order them monthly, is the same cost as Flintstones, only it has everything that is recommended by the ASMBS, which is our national organization. So when you go by their guidelines, you know that you're getting exactly what you need. So I'd be interested in, if you bring the label in, yeah, we can compare just to see.
Yeah.
And it's interesting because, believe it or not, some of the micronutrients like the zincs and the coppers, the Flintstones vitamins actually did very well on those, but there were a lot of areas that they did not have enough compared, based on the recommendations. So it's good to look and just make sure that you're getting enough.
They just had them on sale, and it was like, maybe not even $15 a bottle or something. Because I was doing the bariatric advantage, and $40-something
They're expensive.
a bottle. I'm like,
Yeah.
this is a lot of money.
Yeah, the grid that I put together shows what the recommendations are, how each of the vitamins stack up, and then at the bottom it talks about monthly cost.
Do any of yours have probiotics in it?
I don't think any of the ones that samples or the ones that I evaluated did. And probiotics can be expensive as well, but depending on which brand you get.
And that's what I've found that I've needed lately because of the stomach issues, the intestinal issues.
Sure, yeah.
Pick them up at Costco when they go on sale. Read those monthly ads.
Yeah.
They're on sale, something's on sale. Go pick up a supplement, the hair, the biotin, and stuff like that.
Well, I'm glad some of you guys came back. So it's good to see you. Hope you come and get involved in some of the other things that we've got going on, and come do yoga with us.
I can't get here
Yeah.
It takes me 45 minutes to get here, so.
Yeah. And yoga and the weightlifting classes, or even the cooking classes, not only they're live streamed on YouTube, but if you want to check out a cooking class or something like that before you drive in or make plans, just go to NGMC Bariatrics within YouTube. It'll pull up our channel, and if you go to videos, they're archived on there. So you can check it out and just see what, is it worth the drive in? What's it like? What are they making? I have some patients that live out of state. I know lately I've had a lot of patients that have come down from North Carolina. So that's why we have the social media platforms that we do. Because even if you live a distance away or you struggle driving at night or something, you can still get that support.
So the people who live out of state, do they have to come as often as if you lived here in state?
So they have the same requirements pre-operatively as somebody who lives here, but afterwards, what I recommend is if they already have an appointment with the dietitian, for example, try to make it on a day when there's something else available, because potentially they could come for a weightlifting class, a support group, and a dietitian appointment, and then shop in the Berry Boutique at the same time.
Okay.
So I recommend that they try to kind of combine things, but if nothing else, they've got the social media stuff. Yeah. And for some people too, they can look for local support groups that are near where they live too, just so they can continue to get support. Alright, well you guys are welcome to follow me upstairs if you want to check out the Berry Boutique or come up and get samples or protein supplements and that sort of thing. Whatever you do, stay warm. It's going to be really cold tonight.